हेलो गाइस। तो नर्सिंग एप्टीट्यूड का चैप्टर 4 हम लोग स्टार्ट। चैप्टर 4 इज़ वेरियस इंपॉर्टेंट डिपार्टमेंट ऑफ हॉस्पिटल्स एंड दीज आर द टॉपिक्स हियर। Now we start with chapter 4. Topics start here. Hospitals are complex organizations that are consist of numerous departments that work together to provide quality healthcare to patients. Each department plays a unique role in the functioning of the hospital. In this chapter, we will discuss the various departments that constitute a hospital, including the outpatients department, OPD, inpatient services, IP, medical department, nursing department, paramedical department, physical medicine and rehabilitations department, operation theatre complex, OT, pharmacy department, radiology department, x-ray, dietary department, non-professional services, businesses management, medical record department, MRD, and personal department. Now topics start here from outpatient department, OPD. The outpatient department is OPD is the first point of the contact for patients seeking medical attentions in the hospital. Patients visit to OPD for consultations with the doctor, diagnostic tests, and minor procedures. The OPD is usually divided into various clinics such as the general medicine clinic and surgical clinic, the gynecology clinic, and the pediatrics clinic. Each clinic is staffed by doctors who specialize in the particular area of medicine. OPD is responsible for handling a large volume of patients every day. The staff in the OPD must be efficient and well trained to manage the high patient follow patients that are trained based on the severity of their condition, and those who require urgent attentions are given priority. The OPD also has a pharmacy where patients can purchase prescribed medicines. Next topic is inpatient service, IP. The inpatient service is the department that manages the care of patients who requires admission to the hospital. Patients are admitted to the IP for various reasons, including surgery, acute medical conditions, and chronic illness, and the IP is staffed by doctors, nurses, and other healthcare professionals who work together to provide comprehensive care to patients. The IP is responsible for managing the patient's stay in the hospital. This includes admitting the patients, conducting diagnostic tests, and prescribing medications, providing nursing care, and discharging the patients when they are deemed fit to have the hospital. The IP also have specialized wards such as the intensive care unit ICU and the neonatal intensive care unit and ICU to manage patients with the critical conditions. Next topic is medical department. The medical department has within it the various clinical services. They are medical surgery, gynecology, obstetrics, pediatrics, eye, ENT, dental, orthopedics, neurology, cardiology, psychiatric, skin PD, plastic surgery, nuclear doctor who has control over all medical department. The medical department is responsible for diagnosis, treatment, and management of medical conditions. The department is staffed by doctors who specialize in various areas of medicine, including cardiology, neurology, gastroenterology, oncology, and the medical department with the OPD to various comprehensive care to patients. The medical department is responsible for conducting diagnostic tests such as blood tests, imaging studies, and biopsies to diagnose medical conditions. The department also prescribes medications, manages chronic illness, and provides preventive healthcare services such as vaccinations and healthcare screening. Next topic is nursing department. The nursing department is responsible for providing nursing care to patients. The department is staffed by registered nurses, licensed practical nurses, and nursing assistants who work together to provide quality care to patients. The nursing department works closely with other departments such as the IP and the OPD to provide comprehensive care to patients. The nursing department is responsible for administering medications, providing wound care, monitoring vital signs, and providing patients education. Nurses also play a crucial role in The management of the chronic illness such as diabetes and the hypertension by educating patients on self-care and monitoring their symptoms. Next topic is paramedical department. Paramedical departments are adjunctive to the practices of medicine in the maintenance of the resuscitations of health and normal functioning. They include pathology department. The following laborations are usually found in the pathology department. Bacteriology laboratory. This laboratory studies bacteria and their toxins. Biochemistry. This is considered with the chemistry of living organisms and vital processes. Hematology laboratory. It is responsible for making hemoglobin determinants, coagulations, time studies, red and white cell counts, and special bound pathology studies for anemia and leukemia, etc. Parasitology laboratory. It studies the presence of parasites, the crest and ovas of the parasites that are found in the feces. Serology laboratory. It does blood agglutinations tests, Westermann test, and BDRL, etc. Blood bank. It has the responsibility for collecting the and processing all blood used in the hospital for transfusion. It makes studies the newborn infant who may have hemolytic diseases, such does antibody studies on the parental gland. Histopathology department is prepares tissues for gross and microscopic studies. The paramedical department is responsible for providing diagnostic and therapeutic services to patients. The department is staffed by medical technologies, radiology technologists, and other aligned health professionals who work together to provide quality care to patients. The paramedical department works closely with other departments such as the medical department and radiological department to provide comprehensive care to patients. The paramedical department is responsible for conducting various diagnostic tests such as blood tests, urine tests, and imaging studies to help doctors diagnose and treat medical conditions. The department also provides therapeutic services such as physiotherapy, occupational therapy to help patients recover from injuries and illness. Next topic is physical medicine and rehabilitation department. The physical medicine and rehabilitation department is responsible for helping patients recover from injuries and illness. The department is staffed for physiotherapists, occupational therapists, and speech therapists who work together to help patients regain their strength and independence. The physical medicine and rehabilitation department work closely with other departments such as the IP and work paramedical department to provide comprehensive care to patients. The physical medicine and rehabilitation department provides various services such as physiotherapy, occupational therapy, speech therapy, and recreational therapy to help patients regain their function and independence. The department also provides assistive devices such as wheelchairs and cultures to help patients with mobility issues. Next topic is Operation Theatre Complex. The Operation Theatre Complex OT is the department where surgical procedures are performed. The OT is staffed by surgeons, anesthesiologists, and operating room nurses who work together to provide safe and efficient surgical care to patients. The OT works closely with other departments such as the IP and the radiology department to provide comprehensive care to the patients. The OT is responsible for ensuring that the surgical procedures are performed safely and effectively. This includes preparing the patients for surgery, administering anesthesia, monitoring the patients during surgery, and providing post-operative care. The OT also ensures that surgical equipment is properly maintained and sterilized.